Why dry mouth after 60 is more dangerous than you think. It seems like just a minor nuisance. But what if I told you that having a dry mouth every day after 60 could silently set the stage for infections, tooth loss, poor digestion, and even cognitive decline? As we age, certain bodily changes feel small, but are in fact signals of something much bigger. One of these overlooked signs is dry mouth, medically called xerostomia. It's a condition where the salivary glands don't produce enough saliva to keep the mouth wet. You might wake up with a sticky, parched mouth, struggle to eat dry foods, or feel a constant need to sip water. While that may seem trivial, especially in comparison to heart disease or arthritis, dry mouth is far more dangerous than most people think, particularly for adults age 60 and over. In this video, we'll explore the lesser-known effects of dry mouth in seniors, the underlying biological reasons it becomes more common with age, and, most importantly, what you can and should do about it. Let's dive in. Part 1. What changes in the body cause dry mouth after 60? Our bodies don't operate the same way after 60. Salivary function is no exception. Aging brings natural atrophy of salivary glands, especially the parotid and submandibular glands, leading to reduced saliva flow. But aging alone is only part of the story. Here are 5 key physiological reasons why dry mouth becomes more common in people over 60. Polypharmacy. Seniors often take medications for high blood pressure, depression, diabetes, allergies, or Parkinson's. These drugs, especially anticholinergics, antihypertensives, and diuretics, commonly list dry mouth as a side effect. Even over-the-counter antihistamines can reduce saliva flow. Dehydration. Older adults tend to have a diminished thirst reflex, meaning they may not drink enough fluids. This can easily lead to dehydration, worsening dry mouth. Chronic illness. Conditions such as diabetes, rheumatoid arthritis, Alzheimer's, and Sjogren's syndrome directly affect moisture production in the body, especially in the mouth. Hormonal changes, especially in postmenopausal women, reduced estrogen can impact oral mucosa, changing saliva composition and volume. Nerve degeneration and reduced blood flow. Nerve signaling involved in saliva production becomes impaired with age. Likewise, reduced circulation to the salivary glands contributes to dysfunction. Part 2. What are the consequences of untreated dry mouth? You might think dry mouth is just annoying. But here's what medical studies reveal about the consequences of ignoring this seemingly minor condition. Tooth decay and gum disease. Saliva neutralizes acids, clears food debris, and provides minerals that protect tooth enamel. Without it, bacteria thrive. Elderly patients with xerostomia are at high risk for cavities, especially root caries, and inflamed gums. Oral infections, fungal infections, like oral thrush, caused by Candida, are more likely in dry environments. These can lead to painful swallowing and poor nutrition, difficulty speaking and eating, saliva aids in speech and digestion. Without it, seniors may slur words or struggle to chew and swallow properly. This can lead to social withdrawal and embarrassment, malnutrition, and weight loss. Dry mouth can make eating unpleasant. Over time, this reduces appetite, especially for high fiber or textured foods, leading to nutritional deficiencies. Digestive problems. Saliva contains enzymes like amylase that begin digestion in the mouth. Poor salivation means harder work for the stomach and intestines. Cognitive impact. Emerging research links poor oral health and inflammation with cognitive decline. Dry mouth may be a gateway to these effects by promoting bacterial overgrowth and inflammation. Part 3. What should you not do? When dealing with dry mouth, some instinctive habits can actually make things worse. Don't use mouthwashes with alcohol. Alcohol dries the oral tissues even more. Instead, use alcohol-free mouth rinses specifically formulated for dry mouth. Avoid caffeinated beverages. Caffeine is a diuretic. Coffee, black tea, and cola can worsen dehydration and dryness. Limit sugary or acidic foods. These feed harmful bacteria and promote decay in an already vulnerable environment. Avoid tobacco and alcohol. These irritants damage oral tissues and further reduce saliva production. Don't ignore it. Thinking it's just part of aging is dangerous. Ignoring dry mouth invites chronic disease. Part 4. What can you do about it? Here are scientifically supported steps seniors can take to combat dry mouth effectively. Stay hydrated. Drink small sips of water throughout the day. Use a timer or reminder if needed. Avoid gulping large amounts at once. It doesn't help long-term hydration. Stimulate saliva production. Chew sugar-free gum or suck on xylitol lozenges. These stimulate glands and help neutralize acid. Use a humidifier. Particularly in dry climates or heated homes, this helps reduce overnight dryness. Try saliva substitutes. Over-the-counter gels, sprays, and rinses designed for dry mouth can offer immediate relief. Check your medications. Consult your doctor to see if any of your current drugs could be replaced with alternatives that don't cause dry mouth. Improve oral hygiene. Brush with fluoride toothpaste and soft bristled brushes. Clean dentures thoroughly. Visit your dentist regularly. Schedule cleanings and oral cancer screenings twice a year or more frequently if needed. Watch your diet. Choose moist, soft, nutrient-rich foods. Soups, stews, smoothies, and steamed vegetables are better tolerated than dry crackers or toast. Discuss underlying health conditions. If dry mouth is accompanied by joint pain, fatigue, or dry eyes, ask about conditions like Sjogren's syndrome. Dry mouth after 60 isn't just a symptom, it's a signal that your oral health, digestive function, and even brain might be at risk if left unaddressed. But with the right knowledge and a few smart adjustments, you can take control, restore comfort, and protect your health for the years ahead. If you found this video helpful, please give it a like and subscribe to the channel so you won't miss more useful health tips for seniors. Thank you for watching.